The American Heart Association and the American College of Cardiology have released new blood pressure guidelines. Joining us in studio is Dr. William Cornwell, an associate professor in cardiology at the University of Colorado. Thank you for being here. Tell us what we need to know. What changed?
Thank you for having me. Well, the previous guidelines were published in 2017, and since that time there has been a lot of information that's come forward about the importance of getting blood pressure under control. We're learning that we need to be much more stringent about keeping blood pressure closer to 120/80. In the past, we were a little looser with when we would decide to treat, how we would treat, but we're learning that uncontrolled blood pressure can be very unsafe. It can increase the risk of heart attacks, strokes, dementia, and as society continues to age, there are a lot of risk factors out there for all of these things. Blood pressure is a very identifiable, modifiable risk factor that we want to get in front of ahead of time before it leaves detrimental effects on the body. And that's what these blood pressure guidelines are about.
And you mentioned the guidelines. You also mentioned, you touched on the difference. Why the differences now?
Why the difference is now, in the past 7 or 8 years, there have been a number of studies that have come out that have really demonstrated the benefits of being more strict about treating blood pressure. That's why now, why the urgency now to get this information out so doctors across the country who manage blood pressure can start to be more aggressive in treating it to help prevent the bad things from happening that otherwise would occur if we don't treat it the way that we know we should now.
And this might be a big question, but I'm curious for some of us who maybe our blood pressure fluctuates a little more than others. We find ourselves in some of these like danger zones. What should we be doing?
One of the nice things about the guidelines is it really takes a more personalized approach to the actual individual, not treating an individual based on how societal trends emerge, but how the individual behaves. So the recommendations are now that we have patients monitor their blood pressure at home so that we can see how blood pressure evolves throughout the course of the day, recognizing that everybody's different. We all are exposed to different types of stressors throughout the day, and that might make some individuals' blood pressures go up more than others, and we want to make sure that we're recognizing that and treating it when it occurs.
I like that you're looking at all the variables. What about lifestyle changes?
Absolutely. The guidelines do a very nice job of emphasizing lifestyle factors that we should consider. Diet, salt, alcohol, DASH diets, Mediterranean diets, exercise, healthy sleep habits, those sorts of things are very important. Those are easy things that a patient can do. They can take control of their own health and help lower their blood pressure on their own by making some simple adjustments to their daily life.
So all of those, like, I don't know, the things that you always hear, right? Like stay away from red meat. Yep. Don't put salt on your food. It has enough salt. Like those things are true for the most part.
To an extent, yes, of course, those things are true. We want to be mindful of salt intake, and the guidelines are very specific about daily recommended intake of salt, salt substitutes, the amount of alcohol you should take in, exercise guidelines, all of those things, some very helpful, tangible things that you can try to implement on a daily basis, really to help take control of your health. Bring blood pressure down on your own, and then the doctors are there to provide support with medications if necessary.
Well, thank you. Thank you for clarifying all these new guidelines. And Dr. Cornwell from University of Colorado, we appreciate you.
Thank you.
Thank you.